Good morning and thank you for joining today's Nursing Associate webinar. My name is Debbie Cubitt and I'm one of the Senior Clinical Managers here at NHS England in the East of England and a registered nurse by background. We'll just go around and do some introductions of the people that are presenting today, and then I will pull the slides up and go through the agenda. We really want you to make the most of this meeting. So if at any stage you do have any questions, please either put your hand up, or if you don't feel confident to speak, please do put it in the chat. And obviously people may be watching this on record as well. So hopefully this will answer lots of your questions. I'm going to just go around and do introductions. So Sherry, did you want to come in next? Thank you.
I always end up first. Hi everyone, I'm Sherry. I'm a practice educator, but my background, I was one of the first nursing associates to qualify here in my trust at Princess Alexandra.
Lovely, thank you, Sherry. And Sally?
Hi, so I work with Debbie at Region for the East of England in NHS England, also a Senior Clinical Manager, and I'm a nurse by background.
Thank you. And Wendy.
Hello, my name's Wendy Fowler. I'm a Nursing Education Advisor at the Nursing Midwifery Council, which is your regulators. I am a registered nurse.
Lovely, thank you so much. So I just pull the slides up and we should go through the agenda with you for this morning. So just bear with me one moment while it comes up. Sally, is that showing okay?
It is indeed, Debbie.
Lovely, thank you. So this is our agenda today. So we've kicked off with welcome and introductions. We're going to head to Sherry shortly, who's going to explore with us all my learning, my journey and lessons that have guided me. We will then hand over to Wendy, who's going to give us an NMC update, and then we will conclude with Sally for career progression. So without further ado, I'd like to hand over to Sherry. Thank you, Sherry.
Lovely, thank you. So firstly, thank you so much for giving me the opportunity to be here and speak to some of our about to qualify nursing associates. So I'm just here really to share some of the reflections from my own journey and some of those key lessons that have stayed with me in that time. Thank you, Debbie. Next slide, please. Lovely, thank you. So as I said, I was among the first 3 nursing associates to qualify in my trust right at the very beginning of this journey. However, on top of qualifying into a completely new and still developing role, I was also allocated to a completely different department. So I was working on a medical assessment unit and I moved to a care of the elderly ward. So I wasn't just adjusting to new responsibilities as a nursing associate, but I was also having to learn a completely new specialty, which was alien to me, and a new team and a completely different way of working. And that was really quite overwhelming at times. Thankfully, though, the 3 of us who qualified together were kept together, and that really helped in terms of the support we were able to give each other, because we were around people who were feeling exactly the same as we were feeling. But there were still moments where we felt like we didn't quite know where we fit in, both within the team itself, but also within the nursing family, given the media attention that the role had at the time. But interestingly, that experience also opened my eyes really early to my potential future in training and development and education, because I had a very early career conversation with the practice development lead at the time, and really felt that that's where my passion lay, and here I am now. I guess that was probably the first time I started to look beyond the role that I had just qualified into, but also about the impact I wanted to have on our nursing staff of the future. And that's something that I still really am passionate about. Next, thanks, Debbie. So one of the most impactful parts of my journey, I guess, was the exposure I gained through my placements, and particularly those that were completely outside of any experience I had ever had. So, for example, I had placements with community LD teams and also rapid assessment mental health team, and they were areas that I had never been exposed to in any way, shape or form, but each of them added a different layer of knowledge and perspective to the way I practice even to this day. And they really helped me to shift my thinking from that task-focused approach to a much more goal-orientated, holistic model of care, where you can really consider that whole person, their environment, their long-term needs. And I think that's really important in the way that we practice today. And it wasn't just about my experience either. Some of my colleagues on my course had placements or worked in areas like child and adolescent eating disorder services, mother and baby units, and even forensic settings, which sounded really interesting. And I honestly had no idea some of these services even existed before that programme. And that was a really big moment for me because it made me realise just how diverse nursing can be and how many different directions a career can take. It's not just about nursing at the bedside. And I will be honest, some of those placements really pushed me in ways that I wasn't prepared for. Obviously, I'd not had much exposure to mental health nursing before, and there are very, very big differences in the way that we assess and communicate with that patient group, and that often felt really unknown to me. And that's when my inner imposter started to speak up. She's a bit quieter these days, but she's still there. And then there was my paediatric placement, which to this day I still describe as the scariest placement of my life. My heart palpitates every time I think about it. And I think I cried every day that I was there, not because of the team, they were really supportive, but because children's nursing really tore at my heartstrings. And that didn't just take me out of my comfort zone, it literally dragged me kicking and screaming into one of the most uncomfortable experiences I could ever imagine. But that's where the learning was for me. And I felt that that experience made me stronger. It did quieten that inner voice that said, no, you can't do this. And it allowed me to prove to myself that I could. And that was really important to me. It helped me to take those experiences, however uncomfortable, and embed them into my own practice. And that's where real growth happens, when you're embedding those experiences. So qualifying was a bit of a big moment. After all the self-doubt and the challenges, receiving my PIN felt like real proof that I could do this and I was doing this. And when I got that email from the NMC, I think I felt every possible emotion it's possible to feel in the space of 30 seconds. And then I panicked because I suddenly realised that my next shift, my role and responsibilities had dramatically changed from that of a student nursing associate and as a healthcare support worker. And I remember really questioning, am I actually ready for this? And in fact, I really struggled to leave my house the day of that first shift because I really felt that weight of that responsibility. And it made me think about those memes that we see about looking around for an adult and then realizing that you are that adult. Yeah, that was me probably for about the first 3 months after qualifying. But looking back, I feel that that's really normal. And I'd say it's a really important part of transition to have those feelings, because for me, that sense of uncertainty became a bit of a safety net. So it stopped me from trying to run before I could walk, and it made me more cautious, more reflective, and certainly more aware of my limitations. And I think that did make me safer in practice. So if any of you are feeling that same mix of excitement and fear when your PIN comes, you're not alone. And it doesn't mean that you're not ready. It just means that you care about getting it right. And that's really, really important. So after I qualified, I actually started my top up quite quickly. I think it was 6 or 7 months after. And at the time, it did feel like it was the right decision. I was really keen to progress, but looking back, I do think that there is value in allowing yourself time to consolidate in your role and to really embed that knowledge and build your confidence in practice before taking that next step. I had the additional challenge that I topped up during the pandemic, so my preceptorship was a bit disrupted because of that. It didn't really have the structure or the support experience that it would have had we not been in a pandemic, and that's not reflective of those that were facilitating it. It was just what the world was at the time. But I guess what this has taught me is that timing and support really, really matter. They're the two most important things, I think, that have really supported my development, and that there's no right speed to progress, and taking time to grow into your role isn't a delay. It's you investing in your future as a capable and safe practitioner. So one of the bigger challenges I faced after I qualified was around that blurred role boundary, because at the time there was a lack of understanding around what the nursing associate role was and where it sat within that wider nursing team. And when you add the pandemic into that, everything just became more difficult. We were staffing wards full of COVID patients with a very skeleton staff due to isolating. And that for me did lead to some scope creep. And these were things that I probably would have had more confidence to say no to had I had more experience before that happened. And that's really important for me to reflect on, because it was about that situation and pressure and how can I change the way that I am to make sure that actually I am remaining within those boundaries. And by scope creep, I wasn't doing anything very naughty, Wendy, but it was things like wound assessments, etc., that I shouldn't have been doing as a nursing associate, just to clarify. But the really good news is that scope of competence for NAs and that role clarity is so much stronger now than it was when I qualified in 2019. But having said that, I still think that there is work to do around this. And that's where all of you come in, because you are the voice of NAs moving forward. So use it. It was given to you for a reason. Speak up about what works and what doesn't. Get involved in conversations and decisions that affect your role whenever you can. But most importantly, don't be afraid to say no to something that doesn't feel right or sits outside of your scope, because that's not a weakness. That's being professional, and it's essential for safe practice. So fast forward to now, and if anyone can remember the conversation that I mentioned earlier, I'm now a registered nurse and I'm a clinical practice educator within the practice development team, which is exactly where I wanted to be working. However, despite that progression, a big part of my identity remains rooted in being a nursing associate. That experience didn't just give me skills, it shaped how I think, how I practice, and how I support others, which is paramount to the role that I do. It taught me what it feels like to step into something new and uncertain, and the importance of feeling supported, but also what happens when that support isn't quite where or what it needs to be. And that's given me a real understanding of how important that role clarity, that development, and that advocacy are. And if I'm honest, I'm really proud of how I've taken that forward into how I support my new starters. And I'm proud to have started my nursing career as a nursing associate. And I'm proud to have been a part of those early days where that role was still evolving. I love a challenge, always have done. And I'm proud that it continues to influence the way I work today, because it's not something I feel I've ever moved on from. I've just built on that foundation over the years. And now I feel it's really important to give something back to the nursing associate role, because I've been there. I understand what it feels like to step into a role that isn't always fully understood. I know what it's like to question where you fit, and to sometimes feel like you have to figure things out as you go because no one else knows. And that's why I'm really passionate about championing this role. Although it's not formally part of my role, I want to make sure that there's clarity, support, and the right development opportunities in place for nursing associates, making sure that we can integrate NAs safely into practice. But it's not just about those of you that are already on this pathway. I like talent spotting, and at the moment, having actively supported and encouraged healthcare support workers to develop their careers, I've got several at different stages of the nursing associate journey. I've got one about to qualify, one about to start, and for me that's really special to watch how people grow, and supporting that next generation. And I also think it's important about protecting the identity of the role, and huge progress has been made on that since the early days, but with everything there is still more work to do with that. But the future of this role doesn't really sit with people like me, it sits with you guys, because you're the next wave of nursing associates, and you are going to shape how this role is understood, developed and valued. So stay engaged and stay curious and speak up, because your experiences and your feedback and your voice will directly influence what this role looks like in the future. So if I leave you with anything today, it would be this: embrace every opportunity, even the ones you didn't expect or that feel really uncomfortable, because those are often the ones that shape you the most. And remember that growth doesn't happen in your comfort zone. Some of your toughest days will also be your most valuable learning experiences and really good reflections for your revalidation. Give yourself permission to take your time. There's no rush, and consolidation is just as important as progression, because that's what turns knowledge into confidence. And use your voice, because you deserve to be heard, and your experiences will help shape the future of the nursing associate role for those that come for years after you do. But most importantly, be proud of your journey and never stop being proud. It won't always feel easy and it won't always feel clear, but everything that you experience along the way is building the practitioner that you're becoming, and that in itself is something to really, really be proud of. And you're more ready than you think you are. Thank you.
Oh, that's brilliant, Sherry. Thank you so much for sharing your reflections. And I will confess that I have been watching Sherry right from the word go, because I was practice education facilitator when Sherry first started her journey. So wonderful to hear your journey into your role, Sherry, and some really, really key nuggets there nuggets of information. So thank you so much for an excellent presentation and for being so open and honest with sharing your journey. We really, really do appreciate it. And I'm sure some of our nursing associate students might have some questions at the end. So if you do have questions, do just pop them in the chat for Sherry. Thank you. And hopefully we'll have time for some questions as well. Okay, so I'd like to now hand over to Wendy, who's going to go through the role of the NMC, the code and revalidation reviews. Thank you, Wendy.
Hello there. Thank you. Next slide, please. So, as I said, hello, my name's Wendy Fowler. I'm Nursing Education Advisor with the NMC. I've been here for about 5 years. Prior to that, I was pre-registration education lead nurse in hospital, actually in the East of England. And there's me in that role with a student nurse who is wearing my old nurse's uniform, which she described as vintage, which I'm not sure how I feel about. Next slide, please. I'm going to talk a bit about the role of the NMC, which is fundamental to understanding your relationship with your regulator. I'm going to talk through what happens around registering with the NMC and completing your programme. I'm going to talk a little bit about the scope of practice and nursing associate, and then we're going to pause maybe for a bit of reflection and questions. The code review, the revalidation review, because I've just got a very short period of time today, I'm going to ask my colleagues to send to you as an email, so you can read about that in your own good time. because I don't really want to gamble through that at a rate of knots. And where I think the other points will probably be more useful for this presentation. Is that okay? Tell me if it's not. So at the NMC, we have 3 key roles: regulate, support and influence. Regulate is our prime role. We are the gatekeepers of the profession. Integrity of the registrar is absolutely prime. But to do that properly, we need to think about how we support our registrants and how we use our influence. We need authenticity and understanding of what's happening in health and social care. We need to make sure that our standards are representative of the real world. But we do have limits in terms of our regulatory remit, in terms of support. We can't, for instance, offer clinical advice because that's just not our role, and that could lead us open to doing something quite wrong. And it's taken me a long while to get my head around that idea of our regulatory remit, but it is important. But also to regulate well, we need to understand the registrants who we are regulating. Next slide, please. So here it all is on one slide, exactly what we do. Bottom left-hand circle is around our standards. You will be familiar with them, but you might not recognise them as me talking about standards. So we set education and professional standards. These include the code, which I'm sure you're all very familiar with, and our education standards. So our education standards around the standards for student supervision and assessment, programme standards for all of the professionals on our register. So programmes of education that lead to a registration. So nursing, midwifery, nursing associate are our 3 protected titles, which is midwife, registered nurse, and nursing associate. You don't need registered because there's only one sort of nursing associate. So that's your protected title. And it's nursing associate, not nurse associate. And it's actually against the law to state you're a nursing associate unless you hold an NMC qualification as a nursing associate. So we have set these outcome focused standards. The universities then set their curriculum in accordance with those standards to meet those outcomes. We then approve and monitor those programmes, and that explains something you may have seen with students in different universities doing things slightly differently, which can be really disconcerting. It can be quite worrying, but that's because so long as they meet the same outcomes, that's okay. And because they're all being approved against the same outcomes, and there is that need for flexibility. Not everywhere's the same. An area in say a very rural area will have very different opportunities for practice learning, for instance, than a city centre. So and some universities have more facilities for instance, simulation than others. So, and that's okay, so long as the outcomes are all met. We then maintain the register of professionals. As I say, the integrity of the register is paramount, and do investigate concerns for the tiny minority. And when I say a tiny minority, it's actually fewer than 1% of nurses, midwives and nursing associates that come to the attention of fitness to practice. It's a very small amount. There's a reason why it feels like more. Firstly, let's be human. Bad news travels faster than good news, doesn't it? Somebody said to me yesterday, the bad news is round the world whilst the good news is still tying its shoelaces. I can really understand that. And the other reason for that is there's so many of us. 1.2% of the entire UK population is a nurse, a midwife, or a nursing associate. I live in a small village. I think there, at the last count, 8 of us. We're not big enough for a shop or a pub. We also promote lifelong learning via revalidation, and there are post-registration courses, and the ones we regulate are specialist community nurses and one SCIFN, which is specialist community public health nursing, which people usually work in health visitor roles, and those are for registered nurses. And we're also working at the moment to regulate advanced practice registration. So things like the university courses, renal courses, that sort of thing, we don't regulate. They're entirely the product of a university. We don't regulate those. Next slide, please. So this is a very busy slide. It's one for you to look at and absorb rather than probably understand in its full during this presentation. However, I can talk you through. Essentially, at the end of your programme, your university will inform us at the NMC that you've done everything you need to do. You've done your practice hours, you've achieved the academic award that's required, and you've fulfilled good health and character. The university informs us of that. We then process that and then let you know we've done it. You say, yes, this is me. Here's my registration fee, and you will get your PIN in about a week. It's the legend has it that it takes months, but it doesn't. Sometimes it's a bit longer, and the reason is that we may need to just check a bit of information, maybe a bit of information to get through to us. So if there is that additional check, that does take a bit longer. The other reason is your email going to the spam, and it's quite extraordinary how many times that happens, because your email has become clever and thinks, I don't know these people. I'm going to put this in the junk or the spam. So do check there if you're waiting for response for the NMC. Once you've sent it to your inbox and told your email that this is a trusted person, that shouldn't happen again. Please use an email that you're going to monitor. So think very carefully if it's a university or work associated email and you're not going to keep that. Full disclosure, when I moved from the NHS to the NMC, I forgot to tell the NMC I'd moved my email address, and my revalidation update went somewhere else. So I had to phone a different department at the NMC and inform them. And I could hear the laughter around the room when I gave my new email address as wendy.fowler@nmc-uk. So it just that I want to make that warning loud and clear. So do be clear and mindful of that. And next slide, please. Everyone always asks me about the role of the nursing associate and what a nursing associate can and can't do, and what's the scope of the nursing associate. And I always say, I can't tell you that. But what I can tell you is the kind of parameters of what a nurse, how a nursing associate works. It's not about what you do, it's about how you do it. And that's easiest looking at the proficiencies, the platforms and these have come from our standards of proficiency as a registered nurse or a nursing associate. So this is what how a registered nurse or nursing associate is expected to work. So there are differences where you can see the nursing associate with the pink squares. It's got 6 platforms, registered nurse, 7, and those platforms are slightly different. You are all accountable professionals working under the code, same code, but the level of responsibility is slightly different, and how you work is different. In the code, this is my copy. I've got a paper copy. I'm sorry, we don't actually send those out anymore. But what they do say is about our professions. We do say is the professions we regulate have different knowledge and skills set out in that distinct standard proficiency. Working in diverse contexts and different levels of autonomy and responsibility, but all the professions we regulate exercise professional judgment and are accountable for that work. Nursing associates and registered nurses promote health and work to prevent ill health. This is where it comes to the how this is done. Registered nurses assessing needs and plan care. Nursing associates provide and monitor care. And you will see differences in the proficiencies for registered nurse and nursing associate on that theme throughout the proficiencies. For instance, the proficiency around infection prevention and control, a registered nurse will be around assessing needs, planning care, leading and coordinating around infection control. A nursing associate is about providing and monitoring infection control. So which I've already leapt onto the other differences around leading and managing instead of working in teams. We all improve safety and quality care, but achieve that in different ways, with the nursing associate providing and monitoring care, and registered nurses coordinating, and nursing associates working in teams. So it's not about what you do, it's how you do it. I often explain this best when thinking about an example. So forgive me if anyone's in the room has heard this story before. The example I talk about is me when I was in hospital a few years ago, and I had a cannula for 3 weeks. That every one of those cannulas was put in by a technician, actually. Apart from one was put in by a junior doctor that lasted about 20 minutes. But every one of those was put in by a technician. That's it, you want hole in one every single time. They didn't get involved with the off-duty. If I wanted to go to the toilet, someone else had to help me. That's all they did, is they put the thing in the hole. That's all they did, is put a cannula in the vein. And they put the dressing on, and they filled up the paperwork to say they did it. My nursing associate did my VIP score. They made sure I didn't get that cannula wet when I went for a shower. They replaced that dressing when it came loose. They provided and monitored care for that cannula. My registered nurse advocated on my behalf around, come on, does Wendy not, does she need to be in hospital? She's been in hospital for 3 weeks now. Surely she can go home now. And so they did the big assessments for me. There's a bit of confusion around assessments. Is a must score an assessment? Well, yeah, but no, but's possibly my answer. It is an assessment, but that is what I call a small A assessment, and that's absolutely fine for a nursing associate to do. The big A, the capital A assessment, is the registered nurse or other professional who has this in their role, drawing together all the information about that person needing care and getting that care plan down and evaluating that plan of care. Then the nursing associate delivers and monitors care in accordance with that plan of care. I get asked all sorts of questions about what can a nursing associate do, including things like, can a nursing associate be a nurse in charge? The answer is no, because they're not a nurse. That's quite straightforward. But some also, can a nursing associate collect things from pharmacy? It says in our policy a registered nurse can. And the answer to that is actually that's your local policy. That's not up to the NMC to decide. But perhaps your policy needs to incorporate all of the registered professionals that are working in the teams. Certainly when back in the day when I was working as pre-reg education lead nurse, I got drafted onto lots of different committees, and we reviewed all of our policy and went through each one that said registered nurse with the highlighter pen and said, can this say and or nursing associate? And mostly they could. So, you know, if it's local policy, perhaps you can use your voice to think about how that could be changed. Next slide, please. As I've already said, the professions we regulate have those different knowledge and skills, and that is within the code. It's not one of the numbers, it's in the introductory passage. So I think that might be why it's overlooked. Next slide, please. We all do work beyond our what we learnt as a student. We all do things which are more than our than what we learnt in the proficiencies, but how we work doesn't change, if that makes sense. And it's also important to consider section 13 of the code, which is all about having the knowledge and skills required, working within the limits of your competence, particularly 13.5, completing necessary training before carrying out a new role. And again, this needs to be in accordance with local policy. Your local policy and governance is really important in understanding your role. Next slide, please. I'm going to leave this here because Debbie's going to be waving at me that I'm going over time. Is that probably right?
Get in there, Wendy. Yes,
I'm nearly there. Okay, so what I'm going to talk about revalidation is it's never too early to talk about revalidation. You can start accruing practice hours and CPD as soon as you're on the register. Your preceptorship absolutely does count as CPD. There appears to be a rumour flying around that preceptorship can't be CPD. Of course it can be, and this is, I think, because of the confusion that some mandatory training can't be CPD. What we mean by that, if it's mandatory training that everyone does, it can't be development. But if it's you can link it to the code, and if you can link it to your role as a nursing associate, it certainly is CPD. An example of mandatory training that everyone does would be some moving and handling, health and safety. If your wall clerk's got to do it, if everyone who works in that organisation has to do it, it can't be development. But actually, most mandatory training that nurses and nursing associates do, such as safeguarding, absolutely fine. And you can actually build on that by having a conversation with a colleague saying, okay, we've done our safeguarding training, let's get heads together and talk about a few what ifs. Next slide, please. Do sign up for our newsletters. Easiest way to do that is just go to Google and go NMC, sign up for newsletters, and it'll take you to the right page. It's a really good way of keeping in touch with what's going on with the NMC, and we are reviewing the code and revalidation at the moment. There'll be a consultation out in around September, October time, maybe later. Please watch this space. Thank you. There. I got to my pause.
Lovely. Thank you so much, Wendy. Really, really grateful for your insights and your clarity on the NMC role, on the nursing associate role from the NMC, because I know that there is a lot of questions out there. I'd like to just ask a couple of questions, if I may, before we move on to Sally, if that's okay. If people do have questions, then please don't be afraid to ask. But I've got a couple of questions. If I am a nursing associate and I'm due to qualify shortly, and I'm applied for jobs and maybe haven't got one as yet, should I still apply for my NMC PIN, and why should I do that? And also, if I could be cheeky and double piggyback on that question, how long do I have to apply for my NMC PIN from the time that I've been advised that I've qualified? Thank you.
Thank you. Yeah, that's a really good question, one we get asked a lot. There are lots of myths and legends around this one. You've actually got 5 years to get your PIN, but after 6 months, we will ask for some additional information. Should I get my PIN straight away? This is Nurse Me rather than NMC Me. Nurse Me says, yeah, do it, because then as soon as you're in that position to move into a role, and if I was the person interviewing you and you said, yes, I've got my PIN, I'm good to go, and I'll be really, really impressed by that. You could say, I've got my PIN, I've started to do a bit of reading, I've kept myself up to date by doing this. So yeah, I'd say do it. Can I take a role as a support worker whilst I'm waiting? Yeah, of course you can. We're here at the end, from a regulatory, legal perspective, no problem at all. We here at the NMC can't tell you where you're going to work, what you're going to do, but what you must be absolutely clear is you're taking a non-nursing associate role. If you're taking a non-registered role as a support worker, absolute clear blue water between you as a registrant and you in your practice, and what you can and can't do in practice. You can't do anything that is something for only a nursing associate could do, medications, for instance. But you still need to act under the code if you're a registrant. So things like escalating concerns, things like being needing to escalate concern about vulnerable people, and also section 16 around acting in an emergency, that still counts. But for full clarity, having no one to do the 6 o'clock jogs is not an emergency. And I think that is quite a vital message. So yeah, absolutely can. We can't stop you, but you need to have a very full and frank discussion with that manager to say, look, these are my boundaries. I hope that helps. And I'll put the link in about registering with us.
That is really helpful. Thank you. And I can see Tildy's got a hand up as well. Tildy, did you want to come and ask Wendy a question? Thank you.
Yes, please. Thank you. If you have been applying for jobs and you've got a job, do you have to wait for your PIN to come through before you can start working for that organisation?
Starting working with the organisation doesn't matter, but you need to be absolutely clear on your role, because you're not a registrant yet.
So it would
you would be in a non-registered role because you're not a registrant. You're not on the register.
Obviously,
but we can't interfere with employment. Yeah. But when you're a registrant, you're a registrant, and I'd say it's like Blackpool Rock written all the way through us. I've got my PIN written through.
And when you're doing your preceptorships, obviously you're being supervised as that happens. So do you need your PIN to be doing that?
Well, yes, because you need to be a preceptee in the role.
Perfect. Okay.
It'd be very difficult to be a preceptee as a support worker. Remember everything I've said about that clear blue water.
Okay. Perfect. Thank you very much.
And Tildy, I'd just like to add in there, what you will probably find is if you've got a job as a nursing associate, the employing organisation will guide you through that period of where you're waiting for your PIN. And also, just to pick up on a word that you used as well, when you are undertaking your preceptorship programme, it's not a question of being supervised, because you are an accountable practitioner. So it's a move from being a student at being supervised as a student, but when you're doing your preceptorship program, you are a registered accountable practitioner. So your preceptor the experienced member of staff is there to support you, but not to supervise you. So just to clarify, and I'm not playing with semantics on words, but I just want to make that very clear. I'm the regional preceptorship lead, and there's quite a lot of misconception about what preceptorship is. So that's great.
No, that's great. Thank you.
Okay, so I'm conscious that we will need to move forward, but we've got a couple of really good questions in the chat. So Sally, you've answered Farina, and you're going to catch up on that. Abby has asked, which I think Wendy has already answered, but just to clarify, Abby asks, can you carry on a role as a community carer if no nursing associate roles are available in my area? Wendy, I think you did say you did answer that, didn't you?
I hope so. I hope that worked for you. But it's about that. If you remember what I've talked about, clear blue water, but that role being absolutely clear with your boundaries. I'm here as a support worker. I need to work under the code in terms of escalating concerns and reporting issues and acting under an emergency. But the emergency isn't, we haven't got a nursing associate to do this today.
Lovely. Thank you so much. And do keep the questions coming. And I know that Sherry and Wendy, Sally and I will be able to answer the questions. Well, Sally won't because she's been presenting, but she's super whizzy, so she can probably present and answer questions. But Sherry, Wendy and I will be able to ask them. This is your golden opportunity to ask questions. And obviously, if you're watching it on Catchback, we're trying our best to give the dialogue behind those. So without further ado, I'd like to say a really big thank you to Wendy. Really clear, very concise. And I'd like to now hand over to Sally. Thank you. You're on mute, Sally.
I do apologise. I said, are you putting the slides up, Debbie? Thank you.
Yes, I will. Yeah, of
Thank
course.
you. So my name is Sally Nuttall, and I've said I'm a nurse working in region with Debbie. But the reason why I've put this together to talk about progression pathways is because it is part of our commonly asked questions. We tend to get quite a lot of inquiries regarding progressing onto RN courses. And I was actually an assistant professor at a university teaching on nursing courses, and I was also the admission tutor. So I think I felt that qualified me to take on this particular subject. So progression onto RN pathways, also commonly known as the top up, although we try and avoid using that because it kind of gives the feeling that a nursing associate is an inferior role and you need to top it up to be an RN. So we try and move away from that. But to be fair, everyone knows it as top up. So I don't think we caught that one in time. But there's basically two separate ways. There is the apprenticeship pathway. Many of you may well have utilised the apprenticeship pathway to train as nursing associates yourselves. And as part of that, as training to be nursing associates, NHS England provide your employer with training grants to do that. So when you're training as a nursing associate, it's just over £4,000 or something. But if you're progressing onto an RM pathway, the training grants are a little bit more, and that's because the training requirements to be a nurse are a little bit more intensive than nursing associate. So it's just, it does change year on year, but at the moment it's just over £8,000 a year. And we've also had notification from the CNO team. So Duncan Burton is really passionate about increasing training pathways via apprenticeships. So that there is going to be an increase to that amount, but it is going to have caveats around it, around widening participation and only available in areas of social deprivation. So it may not be available, the increased lift in your area to your employer. The other route is self-funded. Self-funded, you get access to the NHS Learning Support Fund. So this was brought in to try and partway replace the loss of the bursary. It is non-means tested, There's no requirement to pay it back. It's tax-free. It's £5,000 a year, but there are increases to that. So for one example is if you have dependents, you can claim extra funding as another £2,000. This is also your mechanism to claim back travel and dual accommodation expenses for placements. This is something you don't necessarily have access to as apprentices. And you also get access to other things like the Exceptional Support Fund. You also get access to tuition fee loans and maintenance loans, even if you've already accessed student finance before for perhaps a different degree, or perhaps you self-funded your nursing associate course. Because it's a nursing course, you do tend to re-qualify again. But I always say this with, please do check your eligibility. So I try not to make blanket statements around student finance because it is assessed on an individual basis. Many find that with all of that offer combined, that their monthly finances tended to have been quite similar to what they were during their nursing associate apprenticeships. And with direct entry as well, you get access to other grants. So there might be childcare ones, different unions and charitable organisations, but also universities themselves may have different grants for you to apply for. Next slide, please, Debbie. So applying for a self-funded pathway. So in theory, you are eligible to progress onto any 4 fields of nursing. So it's adult nursing, mental health, children and young peoples, or learning disabilities. And interestingly, because Debbie and I have a lens across the east of England, we were quite surprised, weren't we, Debbie? Actually, the amount of numbers that are going into those kind of smaller and more vulnerable professions, such as learning disability, mental health, and children and young people's nursing, opposed to adult nursing. So I think that's actually a great testament to the value of the nursing associate roles. And it's always been on our list to perhaps have a look at some research opportunities in the future, hasn't it, Debbie? It's on our to-do list, because actually would those individuals have progressed or undertaken those other roles other than adult nursing if they hadn't have gone through the nursing associate pathway? And the majority of universities, there's not a special top-up course or shortened career progression course in most universities. All of them that will offer undergraduate nursing degrees will likely have a pathway for nursing associates, and it's basically just joining existing cohorts at a particular stage. So typically it's either at the beginning or partway through year 2 of an adult nursing or any nursing course, BSc, Bachelor of Science. Nursing students undertake 2,300 hours of placement, and the same again in academic study in order to qualify with the NMC. So that's around half of that that you would have done or already to train as a nursing associate. So nursing associates is 2,300 hours combined, whereas in the BSc it's 2,300 hours of placement and then that additional 2,300 hours of academic study. If applying to a different university to which you studied your nursing associate qualification, there is going to be a process where they've got to basically map your transcript of your nursing associate course to their unique BSc course. Because as Wendy mentioned, all courses have the same outcome, they follow the same standards, but they may teach things in different places across the curriculum, and actually their curriculums can be quite different. So it's really important that that mapping process takes place to decipher where it is that you're joining that BSc cohort. That does take time. That is not a small exercise. Having done them myself, it takes a lot of time to do those, many hours, in fact. So please don't be put off if you don't get that decision right away at the point of application. When is it that I will be joining? Because what most universities do, because it is such an extensive exercise to do it, is they tend to have you apply, interview you, have you accept the course, and then they will do that piece of work to determine when it is you're going to join. So please don't be put off by that or get annoyed if you're not getting those answers straight away. But if you've done it, if you're going back to the university of which you studied your nursing associate, hopefully that'll be quite straightforward for you. They'll know exactly where it is that you're joining that course. You also get more choice of provider, and actually there's lots of flexible options now, particularly for BSc programs. We have blended ones which have kind of more online teaching. Some of that can be asynchronous, so it's less kind of heavy on a very structured timetable. Others have specialist destination pathways, like for example in the East of England we have one where curriculums and placements are more focused around community nursing. Next slide please, Debbie. Alternative and interim career pathways. Again, what qualifies me for this is I've never worked in a hospital as a qualified nurse. And actually, when I qualified into a very similar period as what we're experiencing now. So there was tightening of belts on the finances, and actually there wasn't a lot of job opportunities available. So I have walked this path before in my early career. And it did open my eyes. Primary care, so I won't go into too much detail, but in primary care there is a specific offer called additional role reimbursement schemes where primary care networks can draw down a full salary reimbursement, and on that list of professions that they can do that is nursing associates. That's where I think we've seen a lot of growth in primary care for nursing associates, because actually they can continue to draw down on that salary reimbursement whilst an individual is then progressing onto their RN course. So they're still getting paid as a nursing associate, drawing down that funding whilst they're doing progression top-up courses. Social care as well, we've seen huge amounts of expansion and new and evolving roles. It's not just adult care either. We've got nursing associates working in children's services. We've got developing supervision models, and certainly there are examples of nursing associates going on into things like registered care manager roles and senior carer roles. I think outside the box would be my advice, even if it's temporary. And I know from the chat, a couple of you are already thinking about that. So working as carers, as an NA, you have so much experience to bring to aligning roles. And certainly in my career, I've worked in aligning roles that haven't always required me to be a registered nurse. Yet I'm still using all of my experience whilst importantly always acting and operating within my scope of practice and not kind of blurring the boundaries there. There's things like therapy assistants, working in health and justice in the prisons. Not many people think about that. 50% of nursing professionals already work outside of hospitals, but unfortunately we train our nursing professionals to be very hospital centric. So sometimes lots of these different opportunities aren't always, really front and center available to you. So definitely have a look around. Working in pharmaceutical, medical training, sales reps. I worked for Baxter's for a bit as a medical educator. So really broaden your search beyond those NHS jobs. We've got some excellent examples on our student hub of preparing for interviews, but also our student app as well. And there's lots of offers, and there's other webinars as well. But Debbie, do you want to come in and talk about some of the webinars you've been doing in the last kind of few seconds?
Yeah, so I'm just really conscious of time.
Mm-hmm.
But yes, we've got loads of webinars. There's been 6 future ready webinars that are available that will be going onto the student app. We also have had, and those 6 future webinars focus on things like interview practice, branding, CV writing, LinkedIn, etc. So please do keep an eye on the Healthcare Learner Toolkit for all of the information. We really hope that today's session has been very, very useful and has motivated and provided lots and lots of information. We'd like to thank you very much for joining and wish you all the very best for your future career. And a very big thank you to our presenters, to Sherry, Wendy and Sally. Goodbye and have a good afternoon. Thank you.